So, I know I look a hot mess. So, I went to the doctor today, so I was gonna do a update about the CT scan or whatever, and they said that they found she's there. She says she's not quite sure what it is, but they said that they still seen the food in there, so my stomach is not emptying. Something I knew, and some swelling. That my intestines were swollen, and so she wanted to put me on. She said it was the. She thought, or she kind of figured that it was pyro. I think it's H pyro or M pyro or something like that. But she was thinking that it was an infection, trying to put me on a round of antibiotics. I don't like that diagnosis. I don't like that diagnosis at all. I don't believe that because first of all, um, you know what I'm saying. You're not gonna. Your stomach is you're not gonna not poop. You're not gonna do that. So I'm gonna get me another doctor and I'm gonna get me a second opinion because I think what it is gastroparesis. It's spelled GASTROPARESIS. It's where your stomach is slow to empty and you are nauseous. When you eat, you feel full instantaneously. And when you eat like fiber, it's the worst. Like you bloat, you feel like you're about 9 months pregnant. Um, like it's like really hard to like eat anything. Like you got to be very selective on what you eat, and that's what I'm experiencing. And like I said, I've been suffering from this from I when I first started feeling this is when I was like 15 years old, and it's like something that kind of been going and coming and going since I was 15 years old. It it's something like that kind of flares up and then it comes and goes. And I asked her today, I was like, do you think this is something that's the reason why my sugars are out of control? And she's like, I don't know. And I'm just like, what kind of doctor are you? It's just like a lot of unanswered questions, a lot of things that she doesn't know. And so I'm just thinking to myself, I'm just like, oh my God, I don't know if I'm going to check myself into a hospital or what, because this is like so many things that she doesn't know. And I'm kind of like figuring things out on my own. I'm just like kind of giving my own diagnosis or whatever. And so yeah, um, yeah, this has been going on way too long. So I think tomorrow, what I'm gonna go ahead and do is to check my insurance. Go ahead and go because I'm on what is that? Blue Cross and Blue Shield. I'm gonna go ahead and check my insurance and check for another doctor. And because I'm for sure this is gastroparesis. And go ahead and because I'm not gonna take those antibiotics. This is not what it is, and the symptoms don't match up at all. Because I even talked to her. I was like, it don't make any sense. I said, so the symptoms match up with what you're talking about. She's like, no, not really. And then she was like, I'm gonna go ahead and give you the breath test and see if that's what it is. And it's, she was like, the breath test comes back in 3 days, and I'll see you in 3 weeks. I'm just like, okay, and I'm not, I haven't been able to eat in a month, and then you're gonna see me in another month, and I ain't been able to eat. Like this is making me sick, and I'm just so like pissed off, and I'm just I'm sorry for the use of my words or whatever, but I'm pissed off. Like I'm really mad. Like this is too much. But yeah, I thought I would get on here and give you an update from the CT scan or whatever. And then she said that she was going to schedule me an appointment with the gastroenterologist, and um, that's going to be a while, probably another month before I get in with the gastroenterologist. So it looks like I'm gonna be suffering with this for another month, but I will keep you all posted on that. Looks like I'm gonna be losing some more weight, but I'm a figure out like some things that I can eat. I'm gonna be googling some stuff, and because I was looking on her just a minute ago to see some stuff I could eat, and some people was saying some pudding and And some people were saying they couldn't tolerate that. And I also have irritable bowel syndrome, so I'm just gonna be like trying different things and stuff. Like I think earlier I ate like some tuna. I think that was pretty painful when I ate the tuna. It was real painful. And then I drank like a little bit of a glucose shake. Oh god, they're so nasty. It was like a boost shake, like a little bit of a boost shake. That was gross too. Kind of hurt. So, and then I'm making tonight. I'm making like a 7 layer dip for my kids. This is really stressful. At least my sugar's good, so I can't. My sugars are out of whack, and that's the only thing I can say right now is my sugars are okay, but I'm kind of weak. And another thing that I noticed tonight, I was cutting my nephew's hair, and my tips of my fingers went kind of numb, so that's kind of weird. It's like a new symptom. That's kind of weird. And I was thinking about going to the hospital and that maybe they could run some tests. And I was just wondering if maybe I was wondering if I could get maybe see if they could put a feeding tube in place. I asked her, I was like, can I get the feeding tube put in place? And she was like, no, that's like another surgery. I don't really care. I just want the nutrition. I have to get the nutrition. I can't keep going on with the, without having the nutrition. But anyways, like I said, I'm going to, like I said, I'm gonna keep you all posted or whatever, because I know there's other people out there going through the same thing that I'm going through. I know I'm not the only one. They said only like 4% people in the U.S. go through this gastro paresis. Only know that it starts like I bet it's like coming from like stress. Because when I first started going through this, my mom she was really extremely sick, and and that's when I was 15 years old, and that's when I started going through this. So that's what I think. Yeah, it's really late, so I'm about to finish up cooking and feed my kids. And I'll keep you all posted.